So this is lung volumes and lung capacity. I'm going to make it very simple and a very understandable way. We have four types of lung volumes and four types of lung capacity. Type number one of lung volume is tidal volume, abbreviated as VT or TV in some books. We have inspiratory reserve volume, abbreviated as IRV. We have expiratory reserve volume, abbreviated as ERV. And lastly, we have the residual volume, usually abbreviated as RV. And then on the aspects of lung capacity, we have inspiratory capacity, abbreviated as IC. Secondly, we have the functional residual capacity, abbreviated as FRC. And then we have the vital capacity, abbreviated as VC. And then lastly, we have total lung capacity, abbreviated as TLC. So there are also four, so a total of 8 aspects. The most common and the foundation of lung volumes is the tidal volume, which is usually the amount of air inhaled or exhaled in each breath in a normal resting condition, and it is usually 0.5 liters in an healthy adult. So it's from the tidal volume is where we get the other volume, and it is the tidal volume that help us derive the vital capacities or the lung capacities. It's a very crucial aspect of lung volume and lung capacities. Tidal volume, we say it's a resting air inhaled, amount of air inhaled in or exhaled out in a normal resting condition, and from it we get the inspiratory reverse volume, which is a forced inhalation in a normal breathing in addition to tidal volume, and usually it is approximated to be 2.5 liters. And from here we also get the expiratory reserve volume. It is a forced exhalation in addition to tidal volume, and it is usually 1.5 liters. And then we have the residual volume, which is the amount of air that is remaining in the lung after a forced after expiratory reserve volume. So usually residual volume is the amount of air that usually remain to sustain the lung. And so now let's see how we derive the vital or the lung capacities. Yep. So to start with, the so-called inspiratory capacity, which is the total of inspiratory reserve volume plus tidal volume. You see this? So you take normal tidal volume in a resting phase, and then you add it to inspiratory reserve volume, and this is usually around 3 liters. And this means it's the amount of air that the lung can hold during inhalation. So when you inhale to the maximum, you get the inspiratory capacity. Now we have the functional residual volume, residual capacity. Sorry, it's a residual capacity, which is also 3 liters, and it is the total of expiratory reserve volume and residual volume. And that being the case, now we get the vital capacity. Vital capacity is the total of forced inhalation and forced exhalation plus tidal volume. So it's the amount of air that the lung is able to maintain or to circulate in the lung during a forced inhalation and a forced exhalation plus tidal volume, which is the normal breathing cycle. And this all sums up to the so-called total lung capacity, which is always said to be the vital capacity plus the reserve volume, usually 5.5 to 6 liters, as you can see. So total lung capacity is the total amount of volumes that the lung can hold. So it's the ability of the lung to hold all this volume, all these 4 volumes. So this is very vital, and it varies among individuals according to age, sex, and gender, and sometimes with occupation. Like those who run, athletes, have quite a wider tidal volume. Age, children have a little bit low tidal volume because their lungs are still fixed. And with that being said, let's now present this. We have the first one, the 4 volume first, in a graphical presentation. We have the first being the tidal volume, the second being the inspiratory reserve volume, we have the third being the expiratory reserve volume, and the fourth being the residual volume. Usually the tidal volume starts, as you can see. Then we get the super hypertension of the curve, which gives us the inspiratory reserve volume. Then also it goes down a bit, and this is where we get the expiratory reserve volume, and then it continues normal. Now you can see how we arrive at what is so-called inspiratory capacity. But first of all, let's label it. This is the inspiratory reserve volume, as you can see, just above the tidal volume, and just below the tidal volume we have the expiratory reserve capacity. But there is always a residual volume, which is the amount of air that will always remain in the lung, irrespective of a forced inhalation or a forced exhalation. And its residual volume plus expiratory reserve volume will always give you a functional residual capacity. You see this? That's how easy it is. And now, the inspiratory reverse reserve volume plus tidal volume will always give you inspiratory capacity, that is IC. And after getting that, now let's get the vital capacity, which is now a total of inspiratory reserve volume, vital capacity, or we can say inspiratory reserve volume, tidal volume, and expiratory reserve volume. That's what gives us the vital capacity. And all these volumes plus capacities gives us the total lung capacity. Very simple like this. These volumes and capacities are measured with an instrument called a spirometer. Above all, what is important about all this volume is the so-called the minute ventilation. It's always the minute ventilation, which is the same as tidal volume times respiratory volume, respiratory rate, where, for example, if you have 0.5 liters to be the tidal volume and 12 cycle per minute as the respiratory rate, you get 6 liters per minute. And usually which is now the minute ventilation, which is usually abbreviated as MV or VE in some books. Thank you for watching. Stay tuned for another video. Thank you.